Thank you for taking the time to watch this safe and sound information video about clinical governance. Our team works tirelessly to keep everybody involved in our helicopter emergency medical service safe and sound, both in the air and on the ground. Clinical governance plays a fundamental role in this process of safety management, and it is important that everybody understands what it is and how we manage it. During the next 30 minutes or so, we will explain what the term clinical governance means, how clinical governance actually works within the charity, and members of our team will give you examples of how it affects their daily working lives. It would be useful for you to have a pen and paper readily available to make notes. At the end of this information video, we will be signposting you to written reference materials and to people who can answer any questions you may have. Our aim is to save lives, reduce or prevent disability or suffering from critical illness and injury by delivering a first-class pre-hospital emergency medical service to the people of Essex, Hertfordshire and surrounding areas. Our highly skilled and specially trained pre-hospital care doctors and critical care paramedics work alongside our regional partners using helicopters and rapid response vehicles fitted with state-of-the-art life-saving equipment. Our critical care teams are dispatched by the East of England Ambulance Service NHS Trust. We are here to assist everybody who lives, works or is travelling through the region. The service is provided by the charity free of charge to patients of all ages, from every background and faith, who require the most advanced clinical care. Clinical governance is a system through which organisations are accountable for continuously improving the quality of their services and safeguarding high standards of care by creating an environment in which excellence can flourish.
Essex and Herts Air Ambulance has a robust clinical governance system, ensuring that the advanced clinical care on offer is continuously monitored, enhanced and developed so that our patients receive the very best emergency and life-saving treatment. In addition to our own checks, as an independent healthcare provider, we were required to register with the Care Quality Commission back in 2011. And by doing so, this has given us clear and defined standards to work within and maintain. The Care Quality Commission is the independent regulator of health and social care in England. Their role is to register care providers, monitor, inspect and rate services, take action to protect people who use those services, and to act as an independent voice, publishing their views on major quality issues in health and social care. We are also required to have a nominated individual who is responsible for supervising the management of the regulated activity, which is myself as CEO, and a registered manager who takes day-to-day charge of our regulated activities. This is our clinical director. CQC carry out regular checks on registered health and social care services called comprehensive inspections, which are used to make sure services such as ours are providing care that is caring, responsive to people's needs, effective, well-led and safe. These are known as the 5 key lines of inquiry, the CLOEs. An easy way to remember this is with the acronym CRUES. The inspection team will use the CLOEs and information from the planning stage to structure their visit and focus on areas of concern or areas where we are performing particularly well. At the planning stage, we may be asked to supply specific information so the inspection team can structure their visit. They will then visit our offices and air bases and collect evidence of the CLOEs. This is done by gathering the views of airlifted patients and or their families, speaking to staff, crew and volunteers, observing care and inspecting the places where our patients are cared for example, our aircraft, looking at individual care pathways and reviewing patient records, looking at our policies and procedures and evidence that we are following these. We may also be asked to present a presentation to the CQC at the start of the inspection, in which we can give our own view of our performance and how the organisation is led. At the end of the visit, the inspection team will hold a feedback meeting with members of our executive team. At this meeting, the inspection team will give a summary of what has been found during the visit, highlight any issues that have come up, identify any action we need to take immediately, outline any plans for further unannounced visits, explain how they will make their judgments and publish them. CQC will then send us an inspection report, giving us an overall rating. This report will also be available to the public on the CQC website. We have been inspected on several occasions since registering and have always passed these inspections, which indicates the high standard we set ourselves and continue to achieve.
Clinical governance is important because it provides a structure and rationale around all clinical work at Essex and Herts Air Ambulance. Everything we do is aimed at achieving the best outcome for our patients. Operating with clinical governance means that we can interrogate each case and ensure that it is carried out in a structured manner, continuously placing us at the top of our game. Our clinical service is provided by a group of highly skilled individuals including a pilot, co-pilot, critical care paramedic and a pre-hospital care doctor. Pilots manage the aircraft movement and coordinate this at scene. Finally, our pre-hospital care doctors bring a high level of enhanced clinical care, but they are operating outside of their usual hospital environment, unlike paramedics who are familiar with being out in the field. If you put all of these people together and place appropriate clinical governance around them, you have the capability of delivering the highest quality care and the best and most rapid transport capability. As previously mentioned, pre-hospital care doctors bring a higher level of clinical skill, knowledge and legal practice to supplement that provided by the critical care paramedics. Specialist knowledge includes interventions such as chest drains, fracture manipulations and medicines not usually available on standard land ambulances. Their anaesthetic skills also enable us to put patients to sleep and take over their breathing and support their circulatory functions. There is also the advanced assessment capability of the doctor-paramedic team, which is very valuable. Working together, they can act as an enhanced diagnostic kit for the patient. As of 2015, we have formally employed 5 consultants to provide 1 day a week of their time to Essex and Herts Air Ambulance. All of these consultants are experts in their field. The difference between the consultants and the other doctors are their levels of training and the degree of experience they bring. The consultants are there to provide a clinical governance context to the supervision of all pre-hospital care doctors and critical care paramedics. They enhance training and provide consistency in its delivery to all of the new pre-hospital care doctors who join the team roughly every 6 months. We are very fortunate to be able to employ the services of Emergency Medical Service Consultancy, or EMSC. EMSC is an organisation made up of pre-hospital care consultants who, arguably, have more pre-hospital care experience than most of the doctors in the world at present. These highly skilled consultants provide training, weekly interrogations of every case that we attend, and also 24/7 advice to our clinicians working on the ground. This is a unique opportunity for our clinicians, and our clinical governance framework ensures that the quality and care that we provide is both up to date and correct.
Before we hear in person from members of our team, let us take a few moments to think about what clinical governance means to each of us. Please get your pen and paper ready, and using your own words, please write down what you think the term clinical governance means. Thank you. Whether you are a clinician, a manager, administrator or volunteer, it is important that you feel confident and able to talk about clinical governance and your role within it, or in support of it. Let us now ask 3 members of our team what clinical governance actually means to them.
For me, clinical governance means ensuring that what we do today informs and improves upon what we're going to do tomorrow. Clinical governance is multifaceted. It incorporates supervision, education, audit, patient feedback and much more. It provides a feedback loop to ensure we're always giving our patients the very best we can.
To me, clinical governance implies a culture of promoting safe and effective care. To put it another way, I think it's doing the right thing for the right person at the right time and in the right place. How we do that, we continually review all of our clinical practice and we compare it to local and national standards where it exists or where they exist. I think the strongest part of our clinical governance is our weekly mortality and morbidity review, and we encourage a culture of reporting mistakes and near misses in a way that's blame-free and encourages people to speak up and enable change to occur.
Clinical governance for me, as a paramedic working for the Essex and Herts Air Ambulance, is absolutely vital. It allows me and our team to provide the best care possible for every patient. Medicine is ever changing and every patient is different, so it allows us to learn from every patient that we attend, learn from each other and ensure we are up to date with the best practice out there at any one time. It is part of our everyday practice.
As you saw in our mission statement, we have specially trained pre-hospital care doctors and critical care paramedics working together in our helicopters and in our rapid response vehicles to provide pre-hospital emergency medical care to our patients. This skilled team working provides great benefits to our patients, but it has also made our daily working lives more complex as we perform interventions at the roadside that involve the careful management of risk. We are now going to describe the 4 main areas of benefit to patients of this sophisticated working model: decision making, procedures, drugs, and equipment. Decision making is a crucial component of our work. In these moments, our clinicians determine the safety of the patient, others surrounding the scene, and themselves. Combined with the 3 further benefits of patient care, these decisions will vary to each individual case. Our on-scene procedures ensure maximum safety for the patient during this challenging time. Our primary survey will take in minimal but crucial bits of information. What can we see immediately? Is the patient breathing adequately? How is their circulation? And are there any big injuries we need to work on straight away? The secondary survey comprises of a head-to-toe look at the patient, tailored individually for their illness, injury, or situation. The drugs our teams use are checked in 2-person teams to ensure maximum safety and effectiveness. Some of our drugs are not carried by land ambulances, meaning that we bring enhanced care to the patient at the scene. Our variety of equipment, carried across both the rapid response vehicles and helicopters, can be tailored to the patient's illness or injury. In the case of a cardiac arrest, for example, our mechanical CPR device would assist our crew, administering compressions automatically, so the crew can tend to other issues that may arise on scene. We recognise that clinical governance is a reasonably complicated subject, and that for non-clinicians watching this video, it may be hard to remember all of the relevant information. As such, we have created a simple reminder using the mnemonic CARE. At the end of this information video, we will be signposting you to written reference materials that contain this information. Clinical governance can be broken down into 4 core areas: clinical effectiveness, audit, risk management, and education and training. Clinical effectiveness ensures that what we do is best for the patient. This includes making sure that we provide our patients with the appropriate treatment for their illness or injury, and that we transport them to the best hospital for their situation. We continue to keep our clinical effectiveness as robust as possible by staying updated on current changes and laws and reviewing our processes, which is where audit comes in. Auditing is an ongoing internal process. We constantly review our clinical practices. Are we doing everything as safely, effectively, and as well as we could be? We dedicate time to looking at best clinical practice, researching what our colleagues in other air ambulances are doing, and searching for new and exciting developments in other fields. These assessments often need to change, which means the cycle will then begin afresh as we reflect on the effectiveness of our new practices. The term risk management covers a variety of levels and topics. Clinically, risk management can be anything from checking the pharmacy as a 2-person team to ensure that no mistakes are made, to assessing risks on the way to and at the scene of a mission. It is our job to be aware of any risks we may face so that everyone can complete their job as safely as possible for themselves and for those around them. Overall, risk management is built into our strategy. Are we a safe practice? Are we following CQC guidelines and health law? Education and training are crucial, as we need the certainty that our workforce can do their jobs as effectively as possible. For clinicians, we'll make sure that they have surgical training so that they could perform a thoracotomy or amputate a leg safely. All crew will also attend a pre-hospital care course at the Royal London Hospital to test their abilities in high-stress situations. During their month-long probation, they will learn the pharmacy and spend time getting to grips with new techniques. As well as picking the right people for the job, we have to make sure we give them the tools, training, support and understanding they require to succeed in this role. And finally, we must talk about the most important people of all, our patients. Our patients, their families, loved ones and friends are at the forefront of everything we do. We care about them all most deeply, and our patient liaison managers work hard to build and develop meaningful and lasting relationships with the people touched by our service. This helps us as we strive to provide the best possible care and to continually learn about what we are doing and how we could do it better. The patient liaison managers are always keen to hear from you if you have feedback or ideas about the patient experience. Thank you very much for your time and attention today as you have watched and listened to this safe and sound information video. If you have any questions, you can contact the team in the following ways. If you are a member of staff, please use Takeoff, the staff intranet, to assess the written reference materials relating to this video and for the contact details of people within the organisation who can answer any questions you may have. If you are a volunteer, please speak to the volunteer team for the same information. Thank you. We really appreciate your commitment to keeping everybody involved in our helicopter emergency medical service safe and sound, both in the air and on the ground.